Hi, welcome to my channel. I'm a hospital pharmacist and today I'll be going over the pros and cons of hospital pharmacy. So I have about 5 pros and 5 cons to go over today. One pro about hospital pharmacy is that there's less emphasis on customer service as opposed to retail. For me as a hospital pharmacist, the only time I really interact with patients is when I do bedside discharge counseling, and not all hospitals do that. So speaking of customer service, another pro about hospital pharmacy is that we have more independence and it's more task-based. So compared to retail, where it's more customer service based, when a patient comes in, that's when the timer starts ticking and you have to be very quick and efficient and fast, and can be pretty stressful. So for hospital pharmacy, I have a lot of tasks I need to do and complete throughout the day. I need to verify orders, I'll have a lot of per-pharmacy protocols, but I have a lot of independence in the sense that, I'm the one time managing my task and I have to complete it in a timely manner, but I'm the one that determines my day. Another pro about hospital pharmacy is that you really get to collaborate with other professions like doctors, nursing, dietitian, physical therapist, social work. Here are some examples of our typical interactions. We work very closely with the providers. Not only do we help them dose specific medications like Vanco and heparin, but we also help them, catch drug-drug interactions, drug allergies, give them general dosing recommendations or questions. And overall, we're just there to help. For nursing, we help ensure medications are administered appropriately and help answer questions such as checking for IV compatibility, for example. We also work very closely with the dietitians regarding TPNs to ensure patients are receiving the appropriate nutrition, and the list goes on. One great pro about hospital pharmacy is that you don't have to deal with insurance, because we only deal with patients who are admitted to the hospital, and all the insurance issues are dealt by the administrative side of the hospital, so we don't have to deal with any of that. Now for the hours, this could be a pro or this could be a con. It's dependent on the person, but for hospital pharmacy, we do not have the traditional 9 to 5. There are some unique shifts where it is 9 to 5, but majority of hospital shifts are really, really early or really, really late, or there's some mid-shift hours, just because hospitals open 24/7, so there's some very drastic time differences. Be a pro if you are, let's say, an early bird, you like to start the day early, you like to end the day early, or if you're a night owl, you prefer to get to sleep in and start your workday later, then there's shifts that are available for you. For example, for my hospital, most of our shifts are 7:30 to 4. However, there are some mid shifts like 10:30 to 7. There's some that are 3:30 to midnight, and of course there's graveyard. The 12-hour shifts are 7 to 7. One con about hospital pharmacy is that hospitals open 24/7, so there's gonna be times where you have to work the weekend or you have to work a holiday. Most places, they try to keep it fair, so if you work one holiday, say Christmas, then you're most likely not gonna work it the following year. And for weekends, like for my hospital, you only work one weekend a month or so, and they try to space it out because most people don't like to work the weekend, so most places try to make it fair. Another con is that, the work schedule can be a little inflexible sometimes. For most hospitals, you really have to plan your vacations way in advance. If you're more interested in more detail about this topic, you can watch my video about vacations. I just posted that recently, and it kind of goes more in depth of how far in advance your work schedule is, how far the vacation requests are, how it works, so you can check that out. Hospital pharmacy, we do not have the traditional 9 to 5, so this could be a con if you prefer the traditional 9 to 5 hours. And then lastly, another con for hospital pharmacy is that it's rare to really know opportunities for remote work, just because oftentimes as a hospital pharmacist, we have to be there in person to check the IV bags, the compounding that the technicians make to make sure that they make it accurately, Or let's say if you're a medicine pharmacist, you have to go to disposition rounds where you meet with the doctors, nursing, social work, etc. just to see, you know, which patients might be going home that day. I mean, it'd be great possibly in the future, maybe there is a way for us to become remote. But currently right now, it's just not doable. So I'm editing this video and I realize I forgot to film my outro once again. But thank you for watching and supporting this channel. Please click the like button down below or subscribe if you haven't yet. I'd really appreciate the support. And if you have any questions about hospital pharmacy or pharmacy in general, feel free to comment down below. And hopefully I can answer more questions in my next Q&A video.